and I'm here today to talk about the 4th edition of cardiac pacing, defibrillation, and resynchronization therapy. I'm really excited because this is a major revision of our textbook. There have been a lot of new developments in the field over the last 5 years, and it's due time to have a new edition. Some of the very exciting new areas that we are emphasizing or have thoroughly undergone revision and new chapters include a extensive chapter with videos and material on the web that goes over the emerging field of interventional cardiac device implantation. So for the first time, we really focus on what's involved, what's needed, what techniques have been developed to help implant devices. And this new material focuses on venoplasty of the subclavian vein, venoplasty of coronary veins, use of snares to help implant LV leads, incredible new look at and new material on lead extraction, removal of implantable devices, using all the technologies, including laser, including special types of devices that through rotational means free up cardiac leads. Videos showing many of those techniques, and of course the new Heart Rhythm Society guidelines are presented in that areas. Lots of new material on new technologies such as a subcutaneous implantable cardiac defibrillator, and that chapter is actually co-authored by the people who have been involved in developing that new technology and implanting it in Australia and New Zealand, in that area, New Zealand actually. There is new material on leadless cardiac pacing, and one of my co-editors, Dr. C.P. Lau, has been in the forefront of the development of that technology. That's discussed. Of course, as we would expect, there's an update on all the new clinical trials in ICD therapy, in pacemaker therapy, in cardiac resynchronization therapy. The chapters on the basic science of defibrillation and pacing and leads have all been revised and updated with all the new technologies and all the new information that's been available. We have a brand new author who came to us, one of the world's experts from Europe, Dr. Riccio and Fritz Prinzen. Those two have teamed up to do a chapter on the pathophysiology of cardiac resynchronization therapy that's absolutely spectacular and reflects the thinking of two of the people that have been in this field from the very, very beginning. So that's yet one more special. It's a comprehensive textbook in the same way Brunwald is a comprehensive textbook in cardiology, and it is it's got it all there, and it's reachable for people who are nurses or technicians in the field, for people who are medical students or house officers, for cardiac electrophysiology fellows in training in this field, as well as surgical fellows and people who practice in the field. We like to think that it is really definitive in its scope and its attention to detail and its attention to both the basic science but the clinical practice of this field.